times you probably want to also minimize the number of people that are present in the operating room. So this is knowledge that will be have a good impact on everybody that works in the dental practice. So I see we're already live on Facebook. So over to you, Sarie.
Good evening, everyone. And I just want to say thank you so much for SADA for giving me this opportunity to do the presentation. I will share my screen. Okay. So all by myself, working in a dental surgery without an assistant, it can be challenging. But I also believe that we have to just cover a little bit of the dental practice in itself and how the patients are receiving all of this new normal. We forget sometimes that it starts with the patient already by the time he picks up the phone and phone for the appointment, and everything from there is part of his experience in our dental surgery. So just a few minutes that I want to take time to just talk about that a little bit. And then I also think it is so important that maybe it's time to rename our profession, to call it something a little bit more, telling everyone what we are standing for and what our job is all about. The outline for the presentation, we're going to look at the following number of things just as in preparation for seeing the patient. So I'm going to start off immediately with the management of the patient. A recall system, in my opinion, is so important, and especially in this time where we haven't been working for a number of weeks or even months. And I always claim that the best recall system is where you actually book the patient in straight after seeing him for his prophylaxis appointment. We've spent so much time in the surgery trying to motivate the patient of why they need to come back in 4 months' time, 3 months' time, 6 months, whatever the recall is. And the patient is at that stage motivated, so why not use the opportunity? So walk to the front with the patient, tell the receptionist to schedule the next appointment, and more so than not, the patients will be happy to schedule their appointment. Cross referrals between you and the dentist, if you are lucky enough to work with a dentist, is also very important. I don't think you will ever be able to build a strong practice if you just think that you are the hygienist in the practice. You come in, you see the patient, and off you go. So for a real good practice builder, it is important that you and the dentist work together, so that if he sees a patient that hasn't seen you for the last 6 months, that he can refer the patient to you. And also the other way around, when you see that the patient hasn't been to the dentist. We all know what the patients do. When the receptionist tell them that it's time for their cleaning, they tell the receptionist, no, not to worry, I've got clean teeth. Till the dentist put the intraoral camera in their mouth and show them what their mouths look like at that point. Then they want to see you immediately. So this is the time now we can really make that work for both sides. The follow-up phone call for the patient after treatment, I always feel is important. And again, especially at this point in time where we need to work a little bit harder in building the practice and having the patients coming back, it is nice for everyone to know that there's someone that cares. So even if it's just a cleaning that you think was a little bit difficult, the patient might be a little bit sensitive the next day, obviously with an extraction or a root canal treatment that was difficult. Decide between the dental assistants and the receptionist and yourself who will take that role that can spare a few minutes to just phone those patients and just check to see how they are doing. Patient scheduling is also going to be different these days than what we used to. We need to schedule enough time between the appointments so that we can clean properly. We need to take a little bit of a break. It is a lot that we are dealing with at the moment. There's a lot of extra pressure that we didn't have maybe in the past. And we just cannot afford to run late. I mean, if you have a 30 minutes in between patients and you think, oh, I can quickly squeeze someone in, it's not quite 45 minutes, but I can do that. Those days are over because we just cannot run late and steal time from the next appointment. I think it's important to inform the patients of the new protocol and tell them what to expect at the time that you phone them to confirm the appointment. People don't like change. I don't think anyone likes change, but so much more if you are used to a place, you know what everyone is like, how everything is, to all of a sudden find that it's not the way that you can remember it the last time when you've been there is not good. So use this time to just explain to them a few more things. And my emphasis would be telling the patients, this is what we do to make it even more safe, rather than to say, to create a safe environment. Because people are also not stupid. I mean, we've always dealt with HIV/AIDS. We've always dealt with hepatitis and TB and all of those things. So, you know, people might think, but that's been around forever. So why now all of a sudden we go through all this trouble just for the COVID-19 virus? A health questionnaire and the indemnity form. We obviously would like to get new information on a health questionnaire every couple of months if we haven't seen the patient for a year or so, and that can all be done prior to the arrival. At this point in time, it will free up the waiting area and not let patients come in too early for their appointment and stand around. So I think that's a good idea to send it to them before the time. They can fill it in, send it back to us. And that way it makes it easier for everyone at arrival. I love the new brochure that Wright Miller's put together with suggestions that they have for the reception area, and also make mention of the screening questionnaires that you can download. So ask your area rep for a brochure like this, or check it out online. Right, a little bit more about the reception area. Shoe disinfectant doormat, I put it with a question mark. It's not that important for everyone. A lot of people say, well, you know, it is a virus, a respiratory tract virus. It needs close contact. It doesn't matter that much if, you know, if people are not necessarily walking with booties or disinfect their shoes before they come into the surgery. It's up to you. If it's important for you, it is available. And I think it's a very good suggestion so that we can use that. Of course, to give the receptionist also more protection, the protective screens that you can put between her and the patient, I believe is a good idea. A hand sanitizer, especially, you know, the ones that you get with a foot pedal, that is a little bit easier to use, less contamination, or the ones with a sensor. Great idea, as long as there's obviously at least 70% alcohol. And I wouldn't suggest at this point in time to have magazines in the reception area. I know people love to come and relax and read a few articles, but yeah, discourage them from doing that at this point in time, and also then less contamination. If you do have refreshments in the reception area, I would say disposable cups at this point in time for water, juice, or coffee or tea, that would be better. But if you can take that away at this point in time, like I said, you don't want to encourage people to hang around in the reception area, it will be better. And then, of course, patients to arrive alone, if it's at all possible, and then at the time of the appointment only. So if they can sit in the car and wait to get a phone call to enter the rooms, that would be first prize. A surface disinfectant that's available for the receptionist to use after patients have used the pen or the credit card machine, or, you know, touch the working surface, have that available for her. And then, like we know, no one in the reception area with gloves, especially dirty gloves. But doing all of these things and taking the extra precaution, I also feel it's so important that we don't make the patients feel that uncomfortable. It is new to us all and a new way of working. And we need to make up for the fact that we have to adhere to social distancing. And I think with all the comments that you've been hearing people saying, is that what they miss the most is the contact, the direct contact that they used to have. So do the social distancing, but make sure that you are not cold, and that you don't distance yourself in such a way that the patient doesn't feel like he's received in a warm manner. Open doors and windows, always a good idea at this point in time. We want fresh air in the rooms. It's also something less that they can contact, you know, a door handle that they don't have to open that's opened already. So where possible, if we can do that. And then fogging or virucidal spray, also with question marks. At this point in time, there's not conclusion that that's the way to go, that it's necessary to do fogging, but we can, it is for your discretion. There's obviously not ever too much that you can do, but at this point in time, it seems like it is not mandatory yet. And then don't forget about the restrooms. That's where the patient is going to freshen up before and after the treatment. So just as much as the surgery needs to be cleaned where you perform the treatment, make sure that after every patient that's been using the restroom, that gets cleaned as well. Right, so the new way of approaching patients, things that we're going to do differently. Something to think of is how to introduce yourself to a new patient. First contact with the patient, a new patient, is very important to me. You only get one chance to impress a patient. And we know that it is just as important for the receptionist to do her part as it is for you to do your part. And the patient will leave if they do not feel welcomed by the supporting staff as well. Doesn't matter how good you are in the job that you do. So make sure that you think about how you want to deal with a new patient at this point in time, because we can't shake hands anymore and say, pleased to meet you. So recently I had to go to a medical practitioner for the first time, and the way I was received, I can't say I had something else in my mind, but I did not like how I was received because of the social distancing. So we forget what it feels like for the patient. So make sure that at least you're going to have eye contact with the patient. You're going to introduce yourself to say, this is who I am, I'm pleased to meet you, and welcome to the practice. Find ways that we can do and say, things that we can do and say to make up for the physical contact that we can't have anymore. And then, of course, our existing patients. I mean, we have patients sometimes following us for the last 10, 20 years. Definitely some patients that give you that friendly hug, the little children that come running up and jump in your arms, and they're so happy to see you. Or the old lady, you know, the older patients that I mean, they live for appointments like this just to get that little bit of attention. So how are you going to greet them now to still make them feel that you receive them in a warm manner? So don't underestimate the power of your smile and the warmness that you can invite the patient with, even though you can't have the close contact. It is so important to remember that people and patients don't only come to have their teeth cleaned. It is not only a person that a person's mouth that we treat, but we treat a person for who he is. So keep that in the back of your mind. And then I would say all the nice to have in the past is now a have to have, meaning that I think everyone is guilty of something that we haven't done in the past, which we felt like wasn't too great. I mean, I never used to work with a head cover. The last time I put a lab coat over my scrubs was at varsity. Now we just have to do all those small things that we neglected at some point. Right, so receiving the patient, I would say it will be good to just quickly recap the new protocol. You're not going to go into detail, just explaining to the patient what's going to happen from here. Of course, you want to take the patient's temperature before you take them through to the treatment room. And then there and then in the reception area, explain to the patient what to do with a mask. The last thing that you want is everyone to take off the mask and just put it on your clean surfaces or working surface. So explain to them, please put your the mask in your pocket or in your handbag. A lot of dentists and hygienists give the patient a new mask as they walk out of the treatment room. That's also an idea. You're going to take the patient through to the treatment room, of course, and try to make the patient feel at ease, just like you would do in the past, so that they don't feel uncomfortable. I would also say that we need to take care in not apologizing too much for the new things that we do and our behavior that we have in this pandemic time. I often feel if you talk too much and if you apologize, you come across as unsure, and you almost need to talk yourself through the process to just reinsure yourself. So I would say that we don't need to apologize for what we do. It is what it is. We just get on with it and treat that as just being part of you and of what we have to deal with at this point in time. The treatment room in itself, we know that we can't sterilize everything, and I think this is a good time to remind ourselves about that. We can only clean the best we can, and that is just good enough. If we need a sterile environment, we need to take the patient to theatre under GA, which is not possible. Again, I would just emphasize open doors and windows wherever you can. The fresh air is great. That's what we need to have flowing through the surgery. Keep things minimalistic because it's less for you to clean. Whatever is on the countertops is going to get contaminated and needs cleaning. So you definitely reduce the cleaning time in between patients. Again, schedule enough time between appointments. And like I said, it is for cleaning, definitely, but it's also just for you not to be all rushed and all bothered running from one appointment to the next, being able to actually just take a breather, take off the PPE, especially your mask, and actually just breathe in properly. We know it is one of the downsides from the respirator mask that we're using at this point in time, that we can't breathe properly. So it is just good to just take a break, rehydrate yourself, and get yourself in a better state of mind so that you don't feel so rushed with all the extra things that we need to do in between patients. Prepare for each patient before we start working. Get everything out of the drawers before the patient arrives. Look at the file and the patient records. Anticipate what you're going to use for the patient and have it already on the surface so that you don't have to get into the drawers with your dirty gloves and obviously contaminate everything else, or then have to change gloves before you take new things out of the drawer wherever possible. Right, our PPE, what we have available, we obviously have something to cover our hair. We've got a face shield, we have goggles, a mask or respirator, gloves, gown, and shoe covers. That's basically our option. And I suppose we can all go overboard, and this way we won't get anything close to us. But yeah, unfortunately a no-go because it won't be practical. So head cover, either something that you can reuse or disposable head covers. When you look at glasses for protection, try to make sure that you get something that's covering the side of your face a little bit as well. And then when you look at visors, if you are going to work with loops or if you're working with glasses, make sure that there's space between the frame of the visor and then the visor itself. Not all of them have enough space there. And a lot of hygienists or medical professionals say that if the cover is open, like the picture on the left-hand side, where there's a space between the shield and your head, it also, you get a clearer view. It's not like it's fogging up because it's all closed, maybe more so like this one. And then we're going to talk about a little bit more on masks. And I believe Professor van der Vyver also want to just say something at the end about a new mask that he's trying out at the moment. Shoe covers to protect your shoes, and then we obviously want to have a gown over our scrubs. I definitely like something that is high up around the neck so that nothing can get in between the cover of the gown and your skin, and then around the cuffs for your hands as well. And then of course we need our gloves. So a little bit on masks just very quickly. The mask as we know it, the molded mask or the ones that's not shaped, that you shape by yourself. And I always believe that the thicker ones is a little bit better under normal circumstances. There's definitely a thinner and a thicker type of mask. And then, of course, the respirators that we're going to talk about a little bit. So a mask, like we said, is the one traditional, the surgical mask as we know it, which is a loose-fitting mask covering the nose and the mouth. It protects people from fluid that's leaving the wearer, but it doesn't protect the wearer from people around him. Important to acknowledge that. And then a respirator is got a tighter seal, so it's typically your FFP or your N95 respirators. You either get it in non-valved or valved. Your non-valved option, where the filtration system is built into the fabric, it's a little bit lighter than the valve mask, and it's got a two-way protection because it's filtering the in and the outflow. And then, of course, the valve respirator, a little bit easier to exhale, and it protects the wearer from the people around him, but it doesn't filter the wearer's exhalation. So, important point there. So, your FFP1 filters about 80% of the airborne particles. Your FFP2 filters about 94%, and that is similar to the N95, which filters about 95%. And then the FFP3 that filters around about 99% of the airborne particles, similar to your N100, which will filters about 99.97%. A respirator needs to be fitted according to the shape of your face, and it can filter particles down to 0.3 microns and obviously bigger. So now you're going to say to me, but the coronavirus is smaller than 0.3 microns. It's typically 0.06 to 0.14 microns. But we have to remember that the smaller particles, the smaller virus, get influenced by the Brownian motion. So what that means is that the particles that's bigger than 0.3 microns get trapped by the filter in the mask. So when you have the smaller particles like the coronavirus that is smaller than 0.3 microns, and it gets influenced by the Brownian motion, it literally means that instead of the particle moving in a straight line, it flutters in the air. It moves in a zigzag motion. So if you want to compare it, you would say a 0.3 micron is more or less the same than a tennis ball. If you would throw a tennis ball in the air, it will move in a straight line. Though the virus, like the coronavirus, that's much smaller, is like a feather. It can be compared with a feather or even a piece of paper. So if you're going to try and throw that in the air, it won't move in a straight line because it is too small, it's too light. It will move in that zigzag motion, the Brownian motion that they talk about. So therefore, it will get trapped in the fibers of the filtration part of the mask. And that is why those masks will catch the smaller virus like the coronavirus as well. Right, so now the prophylaxis procedure itself. We're going to look at the following. So the first one I want to look at is pre-rinse. I've just taken the 4 common ones available to us at this point in time. The chlorhexidine, which is a poor virucidal, the hydrogen peroxide and hypochlorous acid, and molecular iodine that is definitely virucidal. So how the working is it tears down the microbial cell membranes and then the proteins, of course, as well. And then oxidize the microbial cell in that way. And the virus is vulnerable to oxidation. So very good to use that because it will definitely kill the virus. But what is also important to know is that it does not get into the nasal cavity and the lungs. And the benefits are lost within minutes when the saliva starts flowing. So some people still believe that there is not solid science supporting the benefit of this. The argument is not if it is virucidal or not, but what the benefit is to have the patient pre-rinse. But when you doubt, it's always a good idea. Disposables, always the best to rather use whatever you can dispose of. It's something less to clean, less to worry if it is been cleaned properly. So wherever you can, I would definitely recommend that. And then as well, the protective covers. Whatever you can put a protective cover over, because you can just easily take that out and discard of that rather than cleaning. Moisture control, I didn't put names with everything because depending on which website you look at and which supplier, they call it something different. The Optrogate, very good to get the patient's lips out of the way. It's not going to help you with moisture control, but we all know how difficult it is when we don't have an assistant and you sit with the suction and or the mirror and your scaler, and you need to try to work on a patient that's closing up his lips around the mouth. It is almost impossible. So a great way of getting the lips out of the way. And then your smaller type of suction, the curly one, to put either lingual or buccal in while you work with a high volume suction. And then there's the whole suction system with a lip retractor that you get. I also like the ergo finger because you can either put your index finger in the space, and then the suction is going to follow your scaler as you move from one area to the next, and in that way get most of the moisture. Or you can put your index, your ring finger in the space, and you can use that as a fulcrum so that you can hold the mouth mirror at the same time to see if you want to work lingually or palatally. And then, of course, the dry angle, and then the sublingual pad that you can put under the tongue to try and to get a lot of the moisture. Your bite blocks that you can put together with the small salivary ejector. Mr. Thirsty, also a great idea, and I have something even better than the Mr. Thirsty that I'm going to introduce to you. And then, of course, the Relief and the Pink Petal, great ways that we can use to just get a lot more of the moisture. And then, of course, the other one is another lingual suction that you can either use in the lingual area or in the buccal area. Rubber dam, a lot of people are afraid of rubber dam if you haven't worked with it before. Luckily, my first dentist that I started working with after university forced me to use it, and I will never regret that. Forever, I am thankful that he forced me to use rubber dam, because now I don't know anything else. So to do a fissure sealant with the rubber dam is so much easier. It takes a few seconds to put that rubber dam on, and then it is bliss afterwards, rather than the full appointment trying to keep everything dry and to do the sealant. I've heard dentists before saying that it's impossible to put rubber dam on without an assistant. I can assure you that it is possible. You get the hang of it so quickly. Of course, we need rubber dam, we need our frame, we need floss and a little bit of lubricant just to put on. We need our punch and our clamp forceps, and then, of course, our clamps, and then a scissor just to cut a little hole in for the patient to breathe a little bit easier. There is also a plastic frame rather than the metal one, if you prefer that instead. And make sure that the template that you use is a very good template. If you struggle sometimes because of the holes that you punch, it might just be the template. Not all of them are that great. And I'm happy to forward this example to everyone. If you want to have that, you can email me. And then just the difference in clamps, either the one with the wing or the one without. In my opinion, I prefer the one with the wing. And then, of course, we have the plastic clamp that is a lot easier on the gingiva, especially when you work with children. This is my favorite when I do fissure sealant. The widgets just to secure the rubber dam on the opposite side of where you work. You can also just take a little piece of the rubber dam just on the corner, cut that with a little scissor and just secure the rubber dam in that way. And then, of course, this is just the rubber dam clamp that's just showing you how the clamp fits into the clamp holder. And then there's a very easy follow chart of just how you do it, and it's as simple as this. You have your template that you're going to put your rubber dam over. Make sure it's all nice and straight. You're going to put your holes down for where you're going to work, in which quadrant. You're going to punch your hole, one or more holes, depending on what you're going to do. Some people put the frame on before they put the clamp. I tend to put the clamp first and put the frame on only once it's onto the tooth of the patient. But that makes it a little bit difficult if the rubber dam folds together and you can't see where you are. Literally putting the rubber dam clamp inside and have the forceps and just putting it onto the tooth, and there you are, and you're ready to do your sealant. So as literally taking a few seconds. Reducing aerosol, as we know it, with the high volume suctions, that's all that we had for a long time. And then came about the high volume suction with a mirror. That's a great improvement and helping you quite a bit. But my favorite at this point in time from Dental is the cannula and the funnel. I love the fact that we have a little bit of a better angle on our suction unit rather than just a straight suction like we used to have. And then, of course, with the cannula, with the tip of the cannula that is able to twist, and so that you can move it around depending on which quadrant you work in, makes it a lot easier than just having it to the one side. And then if you prefer the funnel, and these days the modification where it is flat on the one side so that you can keep it close to the patient's cheek, and it makes for a better seal to absorb a lot more of the aerosol. A very good system, in my opinion, is the ISOLITE or the ISODRY or the dry shield. So the ISOLITE, the difference between the ISOLITE and ISODRY is just that the ISOLITE will give you illumination as well, where the ISODRY won't give that to you. I'm going to show you a video on this just now. You have a lovely cheek retractor. You have a part that's cutting off the tongue from, getting close to the scaler. You have the suction part over there down at the bottom. You've got the bite block that the patient can rest his jaw on, and then of course the illumination. And again, a lovely attachment to your suction pipe, nicely bent, that will help you quite a bit with manipulating the suction and the pipe. And then the other option is the dry shield, working similar to the ISOLITE and ISODRY, but again, like the ISODRY, just don't have illumination, but still excellent to just get the aerosol. And there you can see how it gets placed into the mouth, and the bite block being put in between the teeth to bite onto. Make sure that you get the lip of the patient out of the way, that it's not caught. And I would say in this video, I would take the lip out of the way down at the bottom even a little bit more. And then you press the button for the illumination. And yeah, you have something like this that you can then, obviously being able to scale in the first and the fourth quadrant without having to move the device to the other side, because you can do top and bottom. And then the ultimate, I suppose, in aerosol capture will be the external aerosol suction unit. There's different ones on the market. They're obviously a lot more pricey. So if you feel you can spend the money, then that's great. Then that, I would say, is the best at this point in time. And just to show you this video as well, how it works, and you can see the before and after in just a bit. It's quite small. There's definitely enough space for you if you work with a dentist, if you're assistant working with a dentist, to have the device next to you as well. And of course, if you work on your own, such a great help, but really nice and small so that it's not getting in the way. Okay. So that's on aerosol. Cleaning up, I want to discuss sanitize, disinfect, and sterilize in a moment. But surfaces, in my opinion, what's good enough is, as I said, just keep it minimalistic. Whatever you keep on the counter, a good surface disinfectant spray that you can wipe down is good enough. Make sure, ask your area rep of your service, your dental provider or company that you deal with, to make sure that it is a virucidal spray. I must say there's really good ones available that's really efficient. So just make sure that you get the studies, that you know what you are using, and that you can trust that. I'm going to talk a little bit more on suction unit. And then floors, of course, as you clean with the disinfectant over the surface, wherever you can spray, wherever that disinfectant spray is landing on the floors, you can even spray some of that in the air. It's going to retire on the floor. And anyway, a good dry mop afterwards to just clean it up, that it's not slippery, is good enough, in my opinion, for a floor. And of course, okay, then the air cleaning I'm going to talk about, and then the PPE disposal. Make sure that you dispose of that in the treatment room. Take everything. I know that there was a lovely webinar on that as well. It's still on the website, so you can go back and can look at that, of the correct way how to dispose of PPE, taking it all from the inside out. Try not to touch the outside. Try to take it away from you as such. When you remove everything, your head cover, your gown, and just put it all in a disposable medical waste bag, and that goes together with your medical, with your other medical waste in your sterilization area. So just to clear, I'm sure you all know this, but it's yeah, just a nice reminder. Sanitization is chemicals that only reducing the number of microbes, like your bleach, your ammonia, and your alcohol. So a hand sanitizer, and everything that we see in the shops and we see all over the place, it is really most of the times just a sanitizer. A disinfectant is a little bit more potent. It kills, but it doesn't remove the microbes except bacterial spores. And we're looking at things like thymol, sodium hypochlorite, hydrogen peroxide, and quaternary ammonium. And then, of course, our sterilization, which destroys all and any of microbial life, including the bacterial spores. Typically, the steam sterilization is the autoclave and the statum. And then, of course, we get the gas and the liquids. The liquids are very sensitive to the direction of use. So make sure that you follow the directions on how to use it properly. If it says that the instruments or whatever you want to sterilize need to be in there for 10 hours, it's 10 hours. There's no shortcut when it comes to liquid sterilization. How to clean our suction unit. I've just put an example of a few products available. There are hundreds on the market. We all have our favorites. We might not always know what they are doing, what exactly they are doing and how they work. So just in an easy way to try to explain, if you have a solution that is if you have a solution that is chemically based, typically like your PureVac, or there's one from SteriWise as well, you need a lot more liquid, typically 2 liters or more, that you will dilute the chemical into. And then you will literally just flush through the suction unit with all that liquid, quite a bit of liquid. Though ones like microvac or gobble, which is enzyme based, working a little bit differently, in the sense that it is enzymes that you are going to put through in the suction unit. So the enzyme creating bacteria that is going to be in the suction pipe will immediately break down and destroy the organic matter, and it's producing a residual action that is continuously killing off the bacteria and the viruses that's in your suction system. So just make sure that you use it correctly as the manufacturer will advise you to do, but don't think if you use an enzyme-based suction cleaner that you need to use the same amount of water that you would do with a chemical cleanser. And the other thing regarding the enzyme cleaner is that if you switch over from a chemical cleansing solution to an enzyme-based one, that you're going to need to check your filter at least twice a day for the first couple of days or weeks, because of everything that will come loose when it is enzyme-based. So once a day, checking the filter will just not be enough. Right, and then of course, if we want to go as far as sterilizing the air around us, you know, we are concerned about the aerosol that we create and what is in the air around us. There's this lovely sterile air that is not only, or it's not a purifier, it is a sterilizer. So that's the difference between the normal purifiers that I think a lot of us got in our surgeries. And then it treats the contaminated air while you work. So it works different than fogging that you have to do afterwards at the end of the day, for instance, and have to leave the treatment room for a while before you can enter it again. But it works while you work. It's got an internal UVC lamp, and then there's obviously no harmful UV exposure to you. And it makes it great because it's a silent unit as well. And it can cover an area easily of about 120 square meter. Another one, DENTAIR, so there's quite a few of them available. It is all available in South Africa, and if you want more details, you're welcome to email me and I can give you the details of that. Okay, and then towards the end of the presentation, taking care of yourself, please don't underestimate this. We went through a lot of stress with this whole pandemic, and we'll talk a little bit in the end about all of that. But like we said, you know, maybe a little bit more headaches, a little bit more tiredness, just feeling drained with all the extra things that we have to think about, and things that normally would just come, you know, so easily as second nature. Now we have to like really think what we do, really think how we treat the patients, how we still make them feel at ease. It's a lot on us. And you cannot do that if you are not your optimum health and a happy individual. So my take would just be a healthy diet, first of all, to make sure you get in the nutrients that you need. Boost your immune system at this point in time with whatever extra you can get that is good for an immune boost. Get enough sleep. We know that our bodies repair itself while sleeping, so important. To hydrate ourselves, and make sure that you take those 6 glasses of water during the day at least. Sunlight and fresh air. There's nothing that feels so great like a little bit of sunlight, especially now in winter time. But remember, the vitamin D plays a key role in our immune function. It reduces your risk of getting flu. It's a protection against acute respiratory tract infection. It supports lung function and cardiovascular health. So all in all, just so great to have a little bit of sunlight and fresh air. Exercise, always great. You always feel more energetic, especially when you do feel tired and you don't feel like exercise. There's nothing that gets the metabolism going and your energy levels up like a good workout. Again, I can't emphasize enough to schedule enough time between appointments. Take that cup of coffee, take the break, just, you know, refocus yourself. No one is going to you're not going to land up with the medal at the end of the day. No one is interested to know how long you've been working and how non-stop you've been working. It might feel good to say I've been working non-stop, but at the end of the day, it only comes down to you that feels the effect of that, and no one else that cares. Remember, a healthy body equals a healthy mind, a happy mind, always. The two goes hand in hand. And create a pleasant work environment for yourself. The biggest compliment for me, if it's a patient walking into my surgery and say to me, "Sorry, you've got such a happy room." And I never intended to be happy. I just intended to be beautiful for myself, because I need beautiful stuff around me. But if a patient say to me that, "Oh, I'm so relaxed here with you," then I think, okay, well, maybe that's not me. Maybe that's just the meditation music that I play. But if they tell me I have a happy room, I feel so good, because if I'm happy, then it means they're happy as well, and the other way around. And then just a reminder, take care of yourself. Self-care is giving to the world the best of you instead of what's left of you. There's no shame, there's no selfishness in taking care of yourself. You owe it to yourself. And then just the take-home message, the new normal, what we are dealing with, and how we perceive things from now. We look at the economy, and I don't think there's anyone that is not concerned about how things have turned, and it is a worry, and we don't know how long it's going to be like this before it's going to change. But I suppose that's part of the new normal, and anyway for now. Family dynamics is different. Maybe you didn't lose your job, or your husband didn't lose his job, but a family member did, and you need to support that person. And maybe it didn't happen to you, but it happened to a patient, and he needs to support a family member, or maybe a whole family. The new normal is where our profit margin is different from what it used to be. We've got so much more money that we need to spend on extra PPE and extra of everything. And everything is more expensive. And I know sometimes we get upset, and we feel that the providers of all these equipment and our dental materials is taking advantage of us. But it's not true. It is because they need to pay so much more to buy the stuff and to import it, because it is just crazy times all over the world. Our turnover is less, and that's part of our new normal, because patients went through what we went through. Maybe they don't have money, or they're scared to come. But I don't think anyone can say that they are as busy as they used to be. And just remember, there's lots of emotions on the patient's side, that they either feel insecure, they feel scared, and face it, we are not the happiest place to come to. They would rather go shopping before they come to us. So even more so now, it's almost like they have an excuse, and it all influences our turnover and our profit margin. I also believe that this is far from over. I think we're going to live with this for a very long time. And I think there's a good chance that maybe most of us will get the COVID-19 virus. But it is something that we need to deal with, and we need to embrace that is part of new normal. And for all that we know, it might never be the same again like it used to. And maybe that in itself is not a bad thing either. Try to do things differently. This might be the time that you want to rediscover yourself, reinvent yourself. You want to try something new. You want to have a new way of thinking. So be cautious that you don't fall into a trap of moaning because things are not the same anymore, but see this as an opportunity of how can I do things differently. The greatest invention in dentistry came from hygienists, for instance, and I met a couple of those hygienists on international conferences. The lady that developed the pink petal, the lady that developed the relief. I've all met them in person, and they were hygienists just like you and me, and decided they want to do more, and there you go. I don't ever believe that you should discount your service, but rather to add value. People would like to pay for a service that they believe in, and you need to show them what your value is. You're not showing them what your value is to discount your treatment. So find a way of what you can give to the patient that is extra than the person down the road. Why would they choose to come to you, even though you're more expensive? And it is possible to instill that value in that patient. And then lastly, I just want to say every end is a new beginning. And although we get discouraged and although we get worried sometimes and we don't want things to end and we ask questions, why did this all have to happen? Just remember that it is an opportunity for a new beginning where you can change whatever you didn't like in the past. And then just a little bit almost tongue in cheek, if you want to find another way of getting a little bit motivated, is will COVID-19 kill you? And look at the ages between 50 and 95, roughly that's your chance, 0.11%, 60.69, about 0.47%. And look at the description down at the bottom. So it is important that we take this seriously. We don't want to spread the virus because we might be healthy and we might not die, but we might carry it over if we have it to someone else that's less fortunate. But it isn't a reason to panic. I thank you very much. And again, thank you so much for SADA for the invite for this presentation and for my panel, Dr. Metsing, Professor van der Vyver, and Dr. Oosthuizen.
I think Nthabiseng is sleeping.
No, Prof, I'm here.
I'm going to wake you up. I was on my way calling you.
No, but I did announce in the beginning that you're going to share a few slides after Sarie has finished talking. So,
okay, I think let's answer a few questions and then we do that.
Okay, that's fine. That's fine. We've got a couple of questions. So two of the questions are talking about the indemnity form, which SADA has recently cancelled. So one of them is asking if oral hygienists, if there's any form that oral hygienists need to use.
Piet, do you know of a specific indemnity form? I'm not sure of anything specific. I just know the standard one that's available, but it's really just up to you and your practice. And if there's a dentist working for you, there's not something specific that you have to use. It's at own discretion.
Yeah, I'm not sure why SADA withdrew the consent form, but I think most of us are still using it. And it's just modified it for our own practice.
Okay. All right. And then the next question, isn't it better to have the top of the face shield closed to avoid droplets dropping down into the face, or even wearing a cap to help to have the peak prevent droplet or drops?
Piet, do you want to take that or?
I can take that. Yeah, it is recommended, especially if you do an aerosol generating procedure. Then it is better if the shield is closed, because if aerosol goes up, and we've already talked about it in previous webinars, specifically when you use rubber dam, there's one study to show that the aerosol direction is towards the head of the operator, and then aerosols can drop in. If you've got sealed glasses, it's probably not a big problem, but if facial shield is your only protection, then I would suggest you look for a closed shield, or maybe stick some plastic on top of the opening on some of the cheaper shields.
Okay. And then there's one question that would like clarity on mouth rinses. Is it actually effective as once patient swallows and microbes are reintroduced?
If I may, I don't think a patient will ever swallow that much. But even hypochlorous acid, if you ingest a little bit of that, it's not going to make a difference, and it's definitely not harmful. But the evidence is there that it is virucidal, and it will definitely reduce the virus count. Like I said in the presentation, the only discrepancy is how much benefit we will get from that, but there's no doubt that there's a lot of rinses that is virucidal. And I just believe whatever help you can get, you can use. Why not? There's nothing to lose.
Okay, thank you, Sarie. Here's another one. The cannula has little or almost no suction if you use as a suction pipe. noticed during treatment? I think this is a comment, and maybe you can add on to that comment, Sarie.
I think it depends on your suction system, how strong your suction is, and maybe I would rather say just I would advise to just have the whole suction unit looked at. In my opinion, the cannula works very well.
Okay, all right. And then one wants to know who stocks Purivac.
PureVac, I think you can get from Henry Schein, but there's, like I said, there's the chemical ones. All of the service providers got. I'm not convinced that everyone's got the enzyme one, the enzyme-based one. I know Wright Milner's have that one. So depending on what you use, you just have to ask your area rep to just give you the specifications if it is chemical-based or if it is enzyme-based, whatever one you prefer to use.
And then we've got appreciation posts for you, Sarie. One from Mohammed Ismail Mayet, who's giving you a compliment, excellent presentation. We've got an anonymous attendee who's also thanking you and also giving you a compliment on a great presentation.
Thank you.
And then Ndakiva Aino also has a compliment for you and thanking you for a very informative presentation.
I'm very glad. Thank you very much.
It's just praises for you all the way, Sarie.
Thank you very much, Doctor.
And we've also got Derna van Rensburg, who's also giving you praises there. And then we've got examples of hypoallergenic yet effective mouth rinses.
What was the question?
They want to know examples of hypoallergenic but effective mouth rinses.
Are they not talking about hypochlorous acid?
I think they're talking about mouth rinses for people that have hypersensitivity allergies.
Oh, a mouth rinse, not a pre-rinse.
Yeah, mouth rinse.
I'm not sure. I think they have to try different ones to see what will work for them. I think anything that doesn't have alcohol in will be better for someone that is sensitive. Or maybe the tea tree oil one, that's also a good one. Anything natural, and the Bioteen's got a very great one as well. So to try one of those.
Okay. And then we've got Fabian Nyalunga, who's also complimenting you. There's one who, I'm not sure, anonymous, this question on emergency patients. It's not really clear. Please can you retype that question and then we'll go through it. And then there's one, can Sarie please give us the suppliers of the HAVE? My apologies, gadgets that was on the slide. HVE.
Sorry, Piet, what did you say?
No, HVE is high volume evacuation. She wants to know what system
the gadgets.
Okay, it depends which one she's talking about. If she's talking about the ISOLITE and ISODRY one, she needs to order that online. And then the cannula and the funnel, that is from Wright Milner's.
Okay. And then
just make a comment on that.
Yes,
it's very
Prof?
difficult to bring in ISOLITE. I've recently tried to bring in a new unit and they refuse to sell to South Africa. The closest dealer to us is in the UK. So you have to get someone to buy it in the UK and then bring it in. But I think Henry Schein is looking at, because they're the agent in the UK, to maybe look at it in future to bring it in. But at this stage, it's a problem. The other thing you have to consider if you buy a unit is that you can't order mouth props very often. You have to order a lot of them in the beginning. Otherwise, you're going to be stuck with the unit and you can't use it.
Okay. Thank you, Prof. Sorry, the question on cannula, the person who was asking the question has just clarified that they meant a funnel and not a cannula.
A big funnel.
Prof, they don't specify the size of the funnel. They just said they meant a funnel, not a cannula.
Sorry, I had a cannula on a slide and also a funnel. The funnel, you need very good suction to operate it properly. That's why we have dedicated extra oral suction units. The suction on those units is probably 20 times more than our high volume suction. So that's why she comments and says it doesn't work effectively. I think for a high volume suction in your practice, the cannula that she showed works quite well, although I find it to be slightly in my way sometimes. But the funnel itself, you need more suction, in my opinion, to operate it properly. So Dr. Bahari is absolutely correct.
Okay, thank you, Prof. What ppm of hypochlorous acid will you use as a mouth rinse?
I think that's a question for Johnny.
Yes, I was going to say.
The hypochlorous acid, parts per million, Piet, if I remember correctly, 350 to 500.
Yeah, it's a tricky question. I'm not sure exactly what we'll use for a mouth rinse. I think you can probably go up to that level, but I think anything from 20 ppm will be good enough for a mouth rinse. I talk under correction. I think 300-400 might be a little bit too high, although it's not toxic. But I think my final answer would be between 20 and about 200 to 300.
Okay. Thank you, Prof. Thank you, Johnny. Prof, I think this one is also for you. If we close the visor on top, won't we be trapping the aerosols and operator rebreathing these particles?
It's a good question. I mean, we're not dealing with so much aerosol. I think if you in an environment where you spray gas, yes, definitely. But our aerosol production in our surgery is actually quite low. I don't know if the person that asked the question saw my plate that I put on my microscope, and till today I haven't found any aerosol droplets on there. So we're not dealing with a lot of aerosol that will be trapped into that area. If we spray gas or we spray a disinfectant, I think that might be a concern, but not for normal general dentistry.
Okay, and here's another one. Where can you purchase hypochlorous acid? I have trouble getting hold of it.
You can buy it from a lot of companies in South Africa. The 2 or 3 most common companies, or the 2 companies that comes to mind that I know that got all their paperwork in order, is Radical Waters. They are quite easy to find on the internet. And then the other company is Geneon, Geneon. You can contact them, and they've got quite reliable products. But there are many. Dentists text me photos of products from all over the country of companies that sell hypochlorous acid.
Remember, hypochlorous acid is something that is used in the food industry often, eh? So it's not only the medical suppliers that provide that.
Okay. Thank you, Johnny. Thank you.
I think this is a good point to share my slides quickly, and then we can carry on with questions.
Okay, Prof.
If you're happy with that.
That's fine, Prof. I'm okay with that.
Let me just see if I can find my presentation. I've got 4 or 5 slides that I want to share with you guys. The questions that always come up is, what about masks? And are we currently still using the 3M mask or N95 masks? And in this next few minutes, I want to introduce you to a new mask that I mentioned before from the Metal Heart company. It is a very effective mask. And the reason I want to talk to you about this mask is because it's given me things back in my practice. The first thing is confidence and comfortableness. When I wear this mask, I feel like I'm back to where I was about 6 months ago. I can focus and I can enjoy the dentistry. I'm not going to go through the mask in detail, but you can clearly see on the slide that the filtering potential of the mask is very good. The mask is called Pro Plus respiratory mask. I'm going to show you a short video just to show you how easy it fits onto my face. It's small, it's very comfortable to use, and the breathing potential is very, very good. Here we're using an extra oral vacuum suction, and here you can see I'm using it with my microscope. You can see it's got 2 filters, 1 on each side. And I'll just highlight, I think a good thing is to compare quickly the respirator, the N95 with a half-face mask, my favorite one as well, from 3M, and then the Pro respirator mask. And I'll just highlight a few points here. I'm not going to actually talk a lot about the normal respirator, but I'll just focus on the Pro respirator because that's what I want to introduce you. Firstly, it's a tight fitting seal on your face. You actually feel very comfortable and very safe with it. The next one is protection. Remember, we spoke in the previous webinars that some of the other systems has got an exhale valve. Now here you exhale through the filter. So you've got complete two-way protection for you and for the patient when you use this mask. It's designed for reuse. It's disposable at a very low cost. I'm talking about the filters now. For instance, if you do an AGP procedure, you can take the filters out and throw them away. They are really very low in cost, and I'll talk about that at the end. This is a key point. Your breathing is very, very easy, even compared to the 3M one, and definitely a lot better than the N95 mask. The cost is low compared to the other systems, and your comfort level is very high. You feel very comfortable when you use this mask in your practice. Now you might ask, what is the filters? The filters are polypropylene, 7 layers of spun bonds and meltdowns. And a key point here to take into account is the fact that they electrostatically charge. Now, if you remember the webinar we did with Ronnie from 3M, she told you how important this is, that masks or N95s are electrostatically charged to catch those small particles, and what Sarie spoke about, the Bronwyn motion as well. The future version of this mask will also have a nano fabric right in the middle to give you even more protection. But here you can see the key point, R5.50 a filter. So it's 11 Rand a pair. So if you do checkups and you protect your mask with a face shield, you can probably use it the entire day. But if you feel uncomfortable and you maybe created a lot of aerosol, you can actually throw the filters away, and it costs you 11 Rand per pair. That's really inexpensive. Now, something I want to just show very quickly is how to disinfect this mask. You can put it in a dishwasher, you can autoclave it, or you can just disinfect it. Here you can see the two filters. You just pop them out. It's a little plastic disc. Pop the other one out, very quick. And then you can disinfect the mask and those two little plastic shields, either with disinfectant. Here we spray it with hypochlorous acid, and you can let it dry. And you pop the filter back, either a new one or the same one. And it's a few minutes that you got a new mask. But in order to do this, I would recommend that you have 2 or 3 of these masks in your practice, that you can recycle them, so that while you see the next patient, your sterilizing person can clean the mask actually. So let's talk about price, and I want to show you how cost effective this is. A single sample, 1 mask with 4 filters costs you about 70 Rand. And if you have a starter kit that I would recommend that you look at, you get 8 masks and 110 filters for 1,000 Rand. And the recommended usage of these masks are about for 3 months, each one, that you can use in your practice. So here's the company's name for a Pro Plus respiratory mask. I suggest, if you're interested, that you screenshot this. There's the email address and the telephone number, or we can post it on the SADA website as well. But this is really a great deal, especially for you guys that battle to get N95 masks at this stage. I thank you that I could share this with you. I'm going to stop sharing my screen, and then we can go back to Sarie's questions. Back to Sarie.
Thank you very much, Prof. Thank you very much. Sarie, here's another one. Who stocks the suction tips with built-in mirrors?
That is Henry Shine's got them, and Serona's got them as well. Dentsply Serona.
Sarie, we've got a whole lot of praises for you, and I hope you're seeing them on your side. But this particular one, I want to read it. I hope I don't disappoint my Afrikaans teacher from high school. Dankie, Sarie. Sien vir jou werk, or sien vir jou werk. What's that word?
That's bless your work.
Okay, yeah, bless your work. I wanted to to really make my Afrikaans teacher very proud. So,
well, you did indeed. It was very well said, and my pleasure.
Okay, sorry. And then hand scaling still advised, or can we now use ultrasonic scalers?
No, we can use ultrasonic.
Okay. And then here's another thank you from Marcia van Niekerk, thanking you, Sarie. And then we've got Leanne D'Souza all the way from Australia, and she says it's an early start to her Friday, but it was worth it.
I think it's 2 o'clock for her. Hi, Leanne. I'm so glad that you've joined.
And she's happy to see you again, Sarie. Here's another one thanking you, but then also asking, what about heaters in the waiting room?
Yeah, I can't think of something scientific, you know, that the heater can bring to it. Not, Yanni, maybe if you have an idea. I can't say that it's a no from my side. I don't know how effective it will be. If my advice would be to rather have open doors, I would say rather dress warm, that you don't have to use a heater. Definitely not the oil heater, maybe, yes. I wouldn't advise that in a central heating, you know, central heating system though, but rather try to dress warmly so that you can keep the doors and stuff open. Yeah, definitely.
Okay. Is the SaniGuard fogging liquid used for foggers hazardous? It leaves my throat scratchy and my chest a bit wheezy. Is this normal?
My take on this, yes, if you are sensitive, some people are definitely more sensitive than others of what they are breathing in. So to do that would be, or the way to do it is to do that with a mask while you do it, and then exit the room and do not enter back for a couple of minutes till it's settled. I don't know, Johnny, if you want to add something to it, but I know some people can definitely be more sensitive.
Yeah, and it's a matter of experimenting what works. The hypochlorous acid has got so little disadvantages, and it works very efficiently. Maybe it's worth a try.
Can I comment on that as well?
Yes, Prof.
I'm not sure. I think SaniGuard contains QACs that if you fog it, you should be wearing full PPE, and you should not be in the room at least for 15 minutes. So it's not a good product. No, I'm not saying this product. I'm saying QACs to actually use between patients. It's a good idea to fog at the end of the day and then leave, let the whole practice leave. That's in my opinion where it's indicated for. Not for between patients, or especially in the morning before everyone comes in.
Okay, thank you, Prof. And here's another one, sorry. Where can you buy the Relieve Pink Petal Ergo Rest?
It was the Ergo Finger and the Pink Petal and the Relief. It's 3 different systems. Yeah, fortunately, I bought mine when I was at the international conference in America, but you can definitely get them online, definitely available, but unfortunately, you have to buy them online. There's not a supplier in South Africa.
Okay. And then this one, I'm not quite sure what Anonymous is asking, but maybe the panelists will be able to answer. Do you advise one takes a week or time off from work, or we should work as normal?
What was the first bit of the question? Do we advise one?
Yeah, there's no context to the question. It's just the way it is.
Well, if the question is if we should work like normal or just work for a week and take time off, I'm not too sure what they're trying to say. I would say you can work as normal, provided that you don't book the patients too close to each other. Make sure that you have at least 15 minutes between every patient, and that is, of course, if you are not running late, which you can't at this point in time. So if you're going to be concerned if a crown preparation is going to be an hour or an hour and a half, rather book the hour and a half plus another 15 minutes in between. I know some practices even have a half an hour in between. So it depends how busy you are. I saw one of the other comments where someone asked, what do you do if the dentists keep on booking emergency patients in between? My take on that would be have a discussion with everyone in the practice and see if you can't keep designated emergency slots. So you'll have, for instance, one in the morning and one in the afternoon, and that gets crossed off before the time. So you can have it, you know, throughout the year in your appointment book, a certain slot in the morning and in the afternoon. If that slot is not then taken, well, you have another half an hour that you can do something else, but have that slot so that it doesn't get taken up by a normal appointment. In that way, you know, will be able to see an emergency patient. But definitely you have to change the way of scheduling appointments. I do believe that everyone is less busy than what they used to be. So what's the point in, you know, scheduling all the patients, getting them in one slot after the next, and then you can't even fill the whole day or fill the whole week. So rather spread it over a few hours and days so that you see less patients every day and rather work every day. You can count yourself very lucky if you in today's time work, you know, non-stop and have so many patients that you can't find time for them. Then well done for you.
Okay, thank you, Sarie. Prof, there's one who wants to know where they can get the Pro Mask.
Okay, let me repeat that quickly. I'm going to do it slowly that you can write the number down. The company is Metal Heart Medical, and the telephone number is 010-447-3697. Otherwise, you must just text me and make contact with me, and we can give you the details. I just want to confirm quickly. One of my main information sources in COVID is probably George Stomadakis. He's an orthodontist in our study group, and he's just found us a few articles on the previous question of the malference for HOCL, and a few articles show 50 to 500 ppm is sufficient for a malference. Thank you, George.
And then, Prof, we've got a question here. They say, hi, Prof, I'm soaking my goggles and visors in a bucket of Milton solution. Is this good enough? And then there's a second part to that question. Can I do the same with the Pro Mask you just showed us?
You can probably do exactly the same. I'm not sure about the chemical interaction with Pro Mask. We'll have to ask the manufacturer about that. I assume it will be fine if it can go through all the other chemicals that we've used. Milton's is 0.5, I think, sodium hypochlorite. So I would probably be more comfortable with maybe a 1%. I'm not saying it's not effective. Remember, if we're talking about COVID, it's not difficult to kill this virus. Soap and water kills it. So I think Milton's will be sufficient. If we look at other bacteria in our practice, I would probably be more happy with a 1% solution, but it's not wrong.
Thank you, Prof. And what is your opinion on EMS airflow prophylaxis? And is aerosol very high?
I don't think it's higher than any other aerosol. I think it's a very good system, very effectively. I would really recommend that. And I don't think it is higher at all.
Okay. Thank you, Sarie. And we've got a whole lot of praise singing as well, and people being thankful. Marlies de Jager being very thankful. Jennifer Wood, Cecilia LaRue also saying thank you. And then kindly confirm who stocks the Techno Air and APPROACHI price, please.
I suppose that's the air cleaner, the sterile air, and is that maybe what they are talking about?
Techno Air. They're saying the Techno Air.
I'm sure they meant the air sterilizer.
Okay.
Medbay is the distributor in South Africa. and the other one, DENTAIR, is from Vision.
Thank you, Sarie. Prof, we've got our regular Dr. Norman Clement from the United States. He's asking, how many times should you test your staff members, and which testing do you recommend, the oral or the nasal?
Let me first answer his first question that we've missed. He asked if the Pro Plus mask is available in the US.
In the US.
The mask has just been developed in South Africa. It's just been SABS approved, so I don't think it's available, but I'm sure if you make contact with the company, they will be willing to ship you some into the US. Then your second question is, how many times should you test your staff? That's a tough question because, in my opinion, it's very unreliable because you can test your staff today and tomorrow they can get infected in a social event, for instance. So in South Africa, I don't think it's a reality that everyone is testing their staff. Coming to your second question is oral testing or nasal testing, which one would you recommend? I think if we look at the literature, I've seen two very good papers recently where nasal testing is more predictable. They get better results compared to complete oropharyngeal testing. Some test stations use both. Some test stations get very good results with oral or nasal testing. And then we've also recently seen that one specific test station in South Africa gets very bad results, a lot of negative results with oropharyngeal compared to nasopharyngeal. So, but I think if we look at the literature, nasopharyngeal is more predictable if you're looking for the ideal test.
Thank you, Prof. Sarie, here's another one from Elizabeth van der Ham. And let me try to redeem myself. Dankie, Sarie. Wel gedaan, Pink Lady. I think I did it.
Your Afrikaans is just as good. Your teacher, your high school teacher will be just as proud of you.
Got it. Okay. So we've got another question. What product would be a good time sufficient in between patient fogger? I think, Jani, maybe this might be for you. Less chemical poison for doctors or patients. Let me repeat that. What product would be a good time sufficient in between patient fogger?
You know, I'm not the expert on foggers. Prof. Piet is more of a boffin there. But I would say that this the hypochlorous acid will be a safe one. And Piet, maybe you can elaborate a bit more on that.
What was the question? Just repeat it, sorry. I was just checking my WhatsApps.
Okay, Prof. It's asking what product would be a good time sufficient in between patient fogger?
I think Johnny is right. It might be hypochlorous acid, but we are not sure. We just recently, and Johnny was on the webinar as well, that we talked about fogging of hypochlorous acid, and it might not be the safest solution as we think. There might be byproducts that can also influence us as operators and staff in our practice. I think at this stage, it's very vague on fogging, especially between patients. And if you look at the CDC and you look at all these big names, they do not recommend fogging actually in the dental practice. And I think it's because there's not good evidence for this. So I think to answer your question, I would suggest if you fog at the end of the day with whatever product you want and leave the practice. At this stage, there's not good evidence to do it between patients. That will be my recommendation at this stage.
Thank you, Prof. Thank you, Jani. How effective is hypochlorous acid as the chair water bottle for ultrasonic scaling? In the chair water bottle.
Hypochlorous acid is extremely effective and is recommended for all water lines.
Okay. Thank you, Jani. I think looking at the time, we've got about 6 minutes before we can close the session. So we can cover however many questions we can cover in this time, whatever is not covered. it will obviously be answered a bit later on. The 60 to 50 parts per million hydrochlorous acid to be used as a pre-rinse or a mouth rinse. Please clarify.
Yeah, maybe that parts per million, the concentration is a bit extreme. I would say safe, like Piet explained, would be below 10 parts per million.
Okay, but remember, Johnny, we just confirmed with George that he found articles that recommends 50 to 500.
50, that's right.
500.
The other night, 50.
500.
Yeah.
Okay. Thank you, Johnny. Thank you, Prof. Prof, here's one question for you. How long does this mask last?
The manufacturer recommends that you can use a mask for 30 days. It doesn't mean that it's destroyed at that stage, but the fit might not be 100%. So I think a 30-day use period for a 50 Rand mask is very good, because remember the 70 Rand you still includes 2 filters as well, 4 filters as well. So for 50 Rand to use a mask for 30 days, I think is very cost effective.
Okay, thank you, Prof. Sarie, here's another compliment from Shaya Pillay, and she also says she's also got a pink obsession. And then, Prof, here's another question. Do you change the mask after 30 days or the filter? Sorry, I missed it. I realized that you said you can change the filter after an AGP, but what about the mask? Also, can you wear the same mask through the day to treat multiple patients or keep changing it?
I think you can use the same mask if you have a visor. If you don't have a visor, you have to judge what you're doing. If it's checkups and non-aerosol producing procedures, I think you can use it continuously. If you do an aerosol generating procedure, you have to judge. If it's a really severe aerosol producing procedure, wetness on your mask, then I would probably suggest to change the filters and disinfect the mask. I think what this mask has brought into my practice is the fact that if I have 2 or 3 masks, I can take it off and someone can disinfect it while I put a clean mask on. That you can't really have that luxury with N95 masks or with the other masks that are more expensive. So I think that's the way I would recommend it. That's probably not the manufacturer's recommendations. I would suggest you have 3 or 4 and you change it after each patient, unless you do a non-aerosol generating procedure.
Thank you, Prof. Is temperature test, Prof?
I said it just gives you more safety.
Okay. And then there's one, I'm going to address 3 questions and then we close it. We've got 2 minutes to go. Is temperature testing really beneficial?
I think we've answered that.
Okay. And then what about spraying surfaces with hypochlorous acid between patients?
We've answered that as well. I think spraying is fine. I think fogging, as we discussed, questionable. But if you spray it, there's no problem. It's like a normal surface disinfectant. Johnny, maybe you can add to that as well.
Yes, the discussion about the concentrations the other night was that 400 parts per million is a low-level disinfectant, 300 to 500 for sanitizing and cleaning of surfaces, and 6,000 plus for high-level disinfectant. 1 to 2 hours exposure.
Thank you, Johnny. And I think, Prof, this next question as well, you've also addressed it. It's also comparing the Sani Nova fogger with the hypochlorous solution. Which one is better? I think, Prof, you touched on foggers, and unless, Prof, you'd like to add more?
Sorry, just repeat the question. I'm reading the question, but I'm seeing a different. I don't know if you've got a different one.
No, Prof. It says, is the Sani Nova fogger compatible with the hypochlorous solution?
I think it is. I'm not sure. I'm not familiar with the fogger itself, but I think you can put hypochlorous acid in there as well.
Okay. All right. I think we've got a minute. I'm going to give it to the panelists just to give your parting shot. Sarie, I'm going to start with you, and then Prof, and then Johnny will end it with you.
I just want to quickly go back to one of the previous questions. Sorry, my mistake. When the question was asked about temperature, I was thinking of testing. So sorry. So to answer that, it is recommended that you take the patient's temperature. Just keep in mind, if the patient, for instance, sat in the sun, you know, to wait to be allowed into the surgery, then the temperature might be higher. So it's not, you know, you can't always get an accurate reading, and it's not to say that the patient's got a fever just because the temperature is higher, but it will give you an indication. So if you can do that, I still think it's something to go by. So sorry to not answer that question. But otherwise, from my side, just thank you for the opportunity. I'm very grateful if someone found it helpful. And if you want to email me on liebenberg.sarie@gmail.com, then I'm happy to answer any other questions or give advice wherever I can. I thank you very much.
Thank you very much, Sarie. Prof, your parting shot?
I want to comment on two of the questions on the board, or comments. The first one is that someone commented, and I'll say the person's name, Natasha van Rede van Oudtshoorn, just commented that Sanifog, if you use Sanifog, you should not enter the room actually for 2 hours because of the QIC component. And they use that to disinfect ambulances, and that's the recommended time that you should stay out of the ambulance for 2 hours. And then the last one is that someone asked again about the mask. It's 30 days, 30, not 3 days. And with that, I want to say thank you for Sarie. It was a great presentation. I'm considering to start liking pink stuff now as well. You really did well tonight, Sarie, and you make us proud. Thank you very much. And thank you to all the participants again. It was really nice having you all and share some information with you.
Thank you, Prof. Jani?
Thank you very much. I would like to go back to hypochlorous acid just to bring it into perspective. 50 parts per million is excellent to use within the eyes. The concentration is very gentle and very caring on the mucosa. So for the mouth, it works excellent. And then to Sarie, congratulations. You make oral hygienists proud in this country, and I think the hygienists rock. Congratulations on a presentation. Well done. And I think you motivated many of us just to think a bit differently.
Pleasure.
And thank you to the rest of the panel and Dr. Metsing.
Yeah, thank you, Nthabiseng. You're always a great host and putting us all in the right position and answering all the right questions. Thank you for your hospitality.
Thank you, Prof. Thank you, Jani. Thank you very much, team. It's always a pleasure to host you, and I always pick up something whenever there's a presentation. So thank you very much for bringing back the knowledge and taking the oral health sector back to basics. I mean, these are all the basics of infection control or giving proper and good oral health treatment to our patients. Thank you very much and have a great evening.
Thank you.
Thank
Goodbye.
you. Bye-bye.
Bye.
Bye.